Thank you and welcome to our Chicago Partnership event. My name is Robert Turnbull. I am the Regional Director here for our Team North, and we have a ton of great information. So we wanted to welcome you, Medicare agents in the Chicago area, and let's go over our schedule of what we're going to cover today. So first off, we want to talk why Neishloss Fleming, our market overviews of the particular area, the key carriers and plans, and then next steps on your way to success in this particular market. If you have any questions at any point in time during the event, feel free to comment below, and we have members of our team on staff to answer any questions or comments you might have, or feel free to pick up the phone and give us a ring.
Hello, and thank you for joining us today. My name is Chris Holmes, and I am the agency manager here at Neishloss Fleming. And now, we're going to answer the question you really came for. Why Neishloss Fleming? First of all, a little background. Neishloss Fleming was founded back in 1982, so we have been doing this for quite some time now. And we're a national FMO working in all 50 states. And the most important part is, we are a non-captive partnership. And as you can see, we offer a wide range of services. Our goal is to provide a full package to you and your team to help assist in any possible way. So let's delve into the first one. We are going to be your marketing specialists. Here at NNF, we specialize in Medicare Advantage, Medicare Supplements, your PDPs, your ancillary products, and we have a comprehensive portfolio of the top national carriers, along with some proprietary products through the Integrity family. Of course, sales management. You're going to have a dedicated sales team. The onboarding process, our goal is to ensure that goes as smoothly as possible and gets you and your team set up correctly. Next, activation process. If you're not sure what we mean by that, it means that we're going to try to make sure that you can sell the product within the first 90 days of being appointed with it. Agents who sell a product within the first 90 days of being contracted with it are 5 times more likely to continue selling it. And of course, we offer strategic planning sessions. We want to brainstorm with you, help you and your team develop a business plan that's going to be successful, and then of course, help you execute it. And of course, we are able to help connect you with your local carrier reps. Consider us the liaison between you and the carrier reps who really help handle opportunities in your area. Next, administrative support. We all know that this can be one of the trickiest parts of this whole process. But of course, with contracting, we have a team that is specializing specifically in the contracting process, and they are very much in the know on how everything works and how to solve your problems. Of course, commissions. We want to ensure that your commissions are always coming to you, so we always have a commission specialist on hand ready to go ahead and make sure that any issue that you run into is taken care of. Let's not forget about the custom marketing either. We have an in-house graphic designer that offers free custom marketing to our agents and can help you do any sort of advertisements you need, of course with digital and graphic design. And lastly, cannot forget about the compliance. We know that there are a lot of sticky rules in this business, but we do have a compliance specialist on hand at all times. And those are the highlights of what we offer from a sales management perspective. There are tons of other things that we can go over, but for the sake of your time, we're going to move on. So now let's talk about our electronic tools. We have to talk about our industry-leading electronic enrollment platform, Medicare Center. And we will also go over our CSG actuarial quoting engine. So let's go see what Medicare Center is all about.
Have you checked out our new Medicare Center? If not, you really should. It's an all-in-one system built to help agents produce more, with easy-to-use technology that can make a big difference during AEP. Medicare Center simplifies client management. It allows you to track clients through the application process, manage follow-ups, and see how clients' needs evolve from year to year. Plus, Medicare Center lets you compliantly text scope of appointments and use text for obtaining client signatures. You can even receive a text whenever a client signs an app. With Medicare Center, you have access to the latest enrollment and quoting tools for every major carrier, including Medicare App, Medicare Link, and a robust Medicare Supplement quoting system. Medicare Center also has an online learning center filled with guides, demos, and information to help with all kinds of technology solutions. Ready for the best part? You can access everything in Medicare Center with one all-in-one universal login. And all of it is available to you free of charge. To learn more about Medicare Center and how it can help you produce more during AEP, talk to your marketer today or start using it now at MedicareCenter.com.
So, Medicare Center is your one-stop shop for all your Medicare electronic sales. Medicare Advantage products, Medicare Supplement products, prescription drug plans, all from the top national carriers, all from one device with one login. And of course, on this platform, if you're ever caught in a pinch, there is a learning guide and an educational section of the site as well to help you really be able to utilize the site to your full efficiency. Of course, you have the ability to quote and enroll on both Medicare app and Medicare Link. Another great part of this is that you can send these quotes electronically through email, through text, all side-by-side comparisons. And of course, scope of appointment. You can store your scopes here, whether you do them on Medicare Center, you can upload them if you did it on paper, and one of the best that we have seen, and our agents love it, is our electronic SOA system where you can either do it through email or text message. And of course, let's talk about your client management system. This is a great tool to help keep track of prospects, leads, and anybody else that you may be working with. You can store their contact information, their doctors, prescriptions, any sort of notes to help you really keep track of what this specific client is looking for and how to best service this individual. Next, let's go over our CSG Actuarial quoting engine. This right here is still available on Medicare Center, but you can also find it on our website. This provides you an at-a-glance view on Medicare supplements, Medicare Advantage, prescription drug plans, and even ancillary products. It gives you the ability to do a side-by-side comparison, also real-time quotes, and for some carriers, enrollments as well. Another great part about this tool is that you can use carrier analytics. What these analytics will show you is how that product has performed over the years. Not only does the rate increase or drop, but also how many people are on it in specific markets and how much premium they have accredited to that plan. Also, fill the gaps with those ancillary products. As we mentioned earlier, you can do your ancillary products on here as well, and they are a great place to get your quotes. And lastly, what makes this extremely convenient is that you do not need to be at your desktop to use the quoting engine. If you have a tablet or a smartphone, you can simply download the Neishloss Fleming Quote Engine app from the Apple Store or the Google Play Store. And that is what we have for you today on the sales management and electronic tool side of it. There is a ton more that we can talk about, but now it's time to discuss what we can do for you on the sales resources side.
I'm Jess Morgan. I am the operations manager here at Neishloss Fleming, and I want to go over some sales resources we have for our agents, particularly Ready, Set, Go, exclusive lead program, and the agency marketing program. So for our direct agents, we have two very specific programs that we use to help them grow their business. Ready, Set, Go is really targeted for individuals who are new to the MA space or individuals who are in the market, but they kind of want to grow this and they don't really know how to get there. As you can see, we have tiered levels for Ready, Set, Go. And it gets you anything from free business cards to AHIP reimbursement to co-op on lead mailers or newspaper ads. All of this stuff is including a strategic business planning strategy with your sales team. Our exclusive lead program gets you discounts off of lead mailers. 5 apps a month gets you $300, and 10 apps a month gets you a lead mailer for $225. So for our agency partners, we have a different program that we use called Agency Marketing Program. We refer to it as AMPT. This program is a marketing reimbursement program for our GA level agency partners and higher. Different types of qualifying costs will get you reimbursement dollars. Those types of costs could be anything from a BRC card to a newspaper ad to educational or sales meetings. You can turn in the receipts for those costs and we would reimburse some of those costs. We also have agencies that use this for recruiting purposes. Those types of receipts look like a recruitment meeting where you're going on site and having an in-person meeting to kind of recruit agents to you. But please, we are more than happy to talk through any type of marketing expenses you're coming through. So if you have something that maybe isn't listed, talk to us and talk to our team and see if, there's a way that we can partner with you on those types of costs. Additionally, we have multiple sales resources available for agents. Ready Agent is a website we created that has MA information on Medicare, on Med Advantage, Med Supplement. It's a really great place for new agents who are brand new into the market or agents who maybe were out of the market for a while and need a little bit of a refresher. It's a really good tool to reference if you ever have questions on anything too. Our social media is something we're extremely proud of. We, have Facebook, LinkedIn, YouTube, Instagram. Be sure to check us out. Follow us on all of that. Subscribe to our YouTube channel. There's tons of great information on there that we share. And we also run contests. So hopefully you'll get lucky. We have custom marketing and Snoozy available for agents. We have a graphic designer on staff. Her name is Kat Lasarenza. She's a wonderful addition to our team. She can design anything from a newspaper ad to a business card, postcards, flyers, anything that you want to create that's customized. She can, work with you, create the imagery that you would like. We make sure that everything stays compliant so that nobody has any issues or anything there. And we create all kinds of different things for everyone. So Snoozy is our social media and website support program. This program was created as a hands-free social media option for all of our agents. We partnered with a former agent named Ken French. He is the one who runs Snoozy. So we would connect you and Ken, and then you guys would sort of come up with the idea of this is sort of what you want on your website, and he would create and customize that content for you. He also has monthly packages where he will kind of take care of all of the content and all of the posting, and you kind of just watch it happen. So it's sort of magic on the back end.
So Chicago's a really, really good market for Medicare Advantage and Medicare Supplement sales, and we're going to go into some of the dynamics that make it such a good market to operate within. So when we talk about Chicago, we're really talking about the Chicagoland market, like Cook, DeKalb, DuPage, Kane, all of these counties. And the key part to this is there are over 10 carriers offering 50 plans. So this is a growing Medicare Advantage market with a ton of great products and offering a really great array of plans. There's a huge number of Medicare eligible folks in this area at 1.5 million, with around a 30% Medicare Advantage penetration rate. Now the highest percentage is actually going to be in Cook County, where you have the densest population. So if you're operating in this market, Medicare Advantage is on the rise. When we take a look at how that actually breaks down between each carrier here, our market leader really is Humana. The rest are kind of in the running. Humana's had a really long-standing history in the Chicago market, but some of these other folks are really starting to grow when you see Aetna and United Healthcare and HCSIC and even WellCare making some good gains over the last couple of years. And as we see these plans, grab market share, you can really see those benefits develop over time. So we'll take a much deeper dive into which plans are hot, which plans are not in the Chicago Medicare Advantage market. So when we talk about this, we really want to focus on those big players. We have our Humana, United Healthcare, WellCare, Aetna, and Healthcare Service Corporation. We're going to start with the biggest carrier out there with Humana. And their Gold Plus HMO plan. That $0 premium HMO has really low cost sharing, so you're looking at $0 PCPs, $25 specialists, and a really, really low maximum out of pocket at $26.50. I know with the changes they made this year, there were a lot of carriers that jacked that up right to the limit. Humana's staying pat with that super low, and that's a huge factor that most folks look at when they are deciding on a Medicare Advantage plan. Even though such a small number of people really hit that maximum out of pocket, that's the first thing that catches their eye when they look at a plan. So the network's really good on this plan. It's available in Cook, DuPage, Lake, and Will counties. And then it has a ton of additional benefits, such as $120 in over-the-counter. They participate in the Senior Savings Program, which provides insulin at low cost to diabetic individuals. They can get insulin for as low as $35, where those prices were really high prior. They're going to get 24 one-way trips for medical transportation, and this package also includes silver sneakers. So if you have someone who wants to go to a bunch of different gyms, wants to stay healthy, wants to stay fit, they're going to have access to all those silver sneakers gyms that are in network. The second plan we want to look at is a $0 PPO, this Humana Choice Plan, because it's, again, really low cost sharing, the flexibility of a PPO so you can go inside or out of network, you're not limited. And then again, a very low maximum out of pocket on the in-network care and a $45 specialist copay. See a little jump there, but you're going to trade that flexibility with the network for some of those specialist costs. So it's a fair trade-off. Available in a ton of different counties here in that Chicagoland market. And they do also have another series of additional benefits that really add on to the value of this plan. So we're going to have 24 trips of transportation, and their network includes all major hospitals, and they just added Rush and Northwestern for 2021, and in-network access to the Mayo Clinic in Minnesota and Cleveland Clinic in Ohio. So that's a ton of flexibility and a ton of in-network access that really gives you a ton of value when you're looking at these Humana plans, and this is why the folks are picking these plans when they're sitting down at the kitchen table. Next up on our roster is Aetna. So Aetna has a ton of different plans out here, and we really wanted to highlight the shining stars out there. So first off is our Aetna Medicare Value PPO. This is a $0 PPO with really low cost sharing. So you're seeing that $0 PCP, the $35 specialist, and then that wide access to any plans that are in or outside of the network, looking at a very low in-network maximum out of pocket as well. You start to see a trend as we go through these plans too with the low maximum out of pocket, because in particular markets, if that's a major concern to a lot of consumers, they want to keep those numbers low to keep people picking those plans. If they see something that's in the higher range, above $6,700, that might get those people running from that plan. So you're going to see that show up time and time again as we go over these different pockets. Now the Aetna PPO, it includes most of the major hospital systems and utilizes the Aetna Seamless National PPO network. So if you have somebody who is traveling or someone who spends the winter somewhere that is significantly less snowy, they're going to have access to the national network wherever they go that Aetna has network access. So if they're down in Florida or Arizona, if it's in the Aetna national network, they're going to be able to access that without utilizing their out-of-network benefits. It's always going to be in-network. So we have quite a few different counties that this plan's in, and a ton of additional different benefits. Aetna's really good at stacking these on to add a lot of value to their plans. So some of the biggest ones here are really going to be, additional vision, dental, hearing benefits, a little bit of OTs over the counter, that's $60 per quarter. We are having that silver sneakers, but that travel benefit's really the key. It's a wide access plan, so if you have someone that's here and there and traveling, it's going to be the best bet for them. When we refocus on the other side and look more at a limited network, the Aetna Medicare Prime HMO is going to be your biggest banger out there. $0 HMO, ton of great benefits, a ton of great benefits. So really, really low cost sharing too at $0 PCP, $20 specialist, low MOOP, again, that low maximum out of pocket, gonna keep seeing it. And then your inpatient hospital at $175 per day is among the market leaders in how much you would spend if and because that's always, again, other concern is, what happens if I go to the hospital? When you see other plans at $350 a day, this plan is cutting that in half for days 1 through 7. So if you have a 3-day stay in the hospital, you're not breaking the bank here. Additionally, they have the $0 tier 1 and 2 prescription drugs. And this plan's available in a ton of different areas, really, really strong, and has a ton of, like we said, rich benefits on the back end here with $2,500 in dental, $200 in vision per year, and $120 per quarter on the over-the-counter. Again, you're getting access to that silver sneakers, which is, when we talk about gym memberships, it tends to be the one that seniors ask about the most. So having that in there, this is an easy sell for anyone out there. Bringing up third as far as sales go is our United Healthcare. The AARP Medicare Advantage Choice PPO is a low premium $38 with wide open network access. Actually have really low cost sharing for a PPO plan. So we're seeing that $0 PCP, we're seeing a $40 specialist, $3,900 maximum out of pocket. Now, you're also not going to have any type of drug deductible for tiers 1 through 3. So if you have someone who is accessing, who really doesn't utilize too much care in their day-to-day and they do want that ability to travel, this plan also includes access to the United Healthcare National Network. And when we look at those, I mean, that's really the key is when we see these national players come into a local market, when they have that access to a lot of different places, it really appeals to a consumer because you don't know where you're going to go or if you're going to need very specific care. And if you can go to a hospital across the country that specializes in a condition which you are afflicted, it's going to benefit you in the long run and you can make that choice for yourself. So one of the pieces too is, that freedom on these PPOs. And United is one of the best carriers for customer service, simplicity, making everything easy for your consumers. Sign them up with United. They're not giving you a lot of calls about different things. They're able to handle it within the United Healthcare network. Now, with that, this plan actually has a little bit of dental and vision coverage, not the best, but they have their hearing aid copays as low as $375. And that's not a reimbursement, that is actually a copay for a device. They do have additional devices that are available, but that's going to get you a hearing aid for as low as $375. And if you have clients that do have hearing issues, which most do, 1 in 3 folks do have some type of impaired hearing once they hit age 65 or above. This could be life-changing for them because a hearing aid can cost between $4,000 and $7,000 by itself. For this, they're getting it for under $400, and that ability to hear is going to let them hear their doctor better, let them have a much more significant quality of life, and overall just help them out in their day-to-day. Additionally, you're getting over-the-counter $50 a quarter, and United Healthcare uses Renew Active as their gym membership, which has a ton of different facilities in it. There, if you ever look at the Renew Active website, you'll see that a lot of gyms are accepting this as part of their network. So United Healthcare additionally has the Walgreens branded Medicare Advantage PPO. This is a $0 PPO with that wide open network access. So you're gonna have national hospitals go all over the country, very low cost sharing with $0 primary cares and $45 specialists, low maximum out of pocket at $5,900, no drug deductible on tiers 1 and 2. Available pretty broad spread of area, geography here that this plan's available in, and a ton of additional benefits that they have stacked onto this plan. So we're talking about $1,000 in dental, the Renew Active gym membership, and again, access to that United Healthcare National Network. If you have, again, someone who's traveling, they want to use care, they want a $0 plan, this is that absolute flexibility and really low cost for somebody who is really not taking advantage or utilizing a whole ton of care throughout the year. Lastly, I want to talk about WellCare. Their value HMO has a built-in point of service benefit. So it's going to give you a $0 HMO, that point of service access if you do want to visit facilities that are outside of the network. very rich benefits, and again, low cost share. So we're seeing $0 PCP, $25 specialist. Again, very, very low maximum out of pocket because the folks in Chicago don't like to see that, and these are the plans that they're signing up for. If it's too high, they're going to run away. Their network includes most of the major hospital systems, and if there is something that a consumer wants to visit outside of that, they have the option to use the POS benefit as well. One of the keys to WellCare's success has been the additional services that they tack on to the plans that they have, and they're very, very rich. So we're talking $195 per quarter on the over-the-counter, transportation, 24 trips, dental, $2,500, vision, $300, and an interesting benefit that sets them apart is the Flex card, which is a debit card that the consumer can use for any type of copays or cost shares that are associated with any of their dental, vision, or hearing. So they can actually, on top of the dental, if they're getting, if they're going over that limit, or maybe they have a pair of glasses that they want to buy and they're $350, they can use that Flex card to add on to that particular benefit and extend it a little bit more. It gives that customer some freedom, some flexibility in how they use their benefits. And that's what these plans are all about. Not shoehorning a consumer into a plan, giving them that option to use the plan how they want to use it. Additionally, WellCare has the Absolute PPO, which is, this plan is really focused around Part B give back. So whatever a consumer's paying for their Part B, this plan is going to kick them back $75 a month on that particular Part B that everyone's paying anyways. So we have a $0 PPO, a very low PCP. So this is a preventative plan. We see the specialist is a little bit higher. The maximum out of pocket's pretty low as well. But really what it is, it's looking at that consumer who is on the move, who's pretty healthy. They might be out riding bikes and hiking. They're not using a whole lot of benefits. So why pay for benefits that you're not using so you can get that Part B reduction? And that's $75 in your pocket every single month. Does have some additional benefits, which are really nice. You see the over-the-counter at $45 a quarter. Not a whole lot, but just enough to make it sweet. Vision, $100, and $350 toward their hearing. Now, for folks in the dual special needs or Medicare and Medicaid eligible, a lot of different markets, there are plans associated with that. But Chicago's a little bit different. We do have the Medicare Medicaid Alignment Initiative that really adds cost share protection to consumers. For most of these folks, when you do go into these plans, they have to opt out of it if they qualify. They're going to automatically be enrolled, and it must say, they must reach out, usually via a letter, say, I don't want to move out of my Medicare Advantage plan. But there are a lot of opportunities to help these folks out because they're not going to have a lot of cost sharing. And some of these plans cover things that Medicare and Medicaid just don't cover, like transportation benefits, some of those other things that they're not going to get through just Medicare and Medicaid. So staying on their plan could be what's best for them, and a lot of times it is the best possibility for them. So there's a lot of opportunities for agents to train their consumers. Hey, this is what's going to happen. You're going to get a letter. You need to opt out. And by doing that, 70% of those folks who are automatically enrolled actually remain in their plans. And there are a lot of different agent trainings. I know we could definitely host one as well that go over how to prepare your client for that transition to make sure that they're staying with you and staying with the plan. So let's bring it all back into a recap. Humana is our #1 selling HMO with very rich benefits. Additionally, they have that broad access PPO. Aetna's bringing to the table a $0 PPO with national network access and a narrower network HMO with very low cost sharing and really rich benefits. United Healthcare has low premium PPO with excellent hearing coverage. Hearing. I hope you're hearing me. United Healthcare, if you're at the kitchen table and you see someone with a hearing aid, you might want to talk to them about that plan right up front. And then they also have the $0 PPO with open network access. Last but not least, we have WellCare with their $0 HMO POS, so it gives you that flexibility and that flex card, so freedom with them. And then that $0 PPO with $75 Part B give back.
Hey everybody, my name is Joshua Smith. I'm the agency director over here at Neishloss Fleming. Today we're going to be talking over the Chicago Medicare Supplement market. So let's start getting right into it. First things first, probably the most important carrier that you can have in your portfolio is the AARP Medicare Supplement, brought to you by UnitedHealthcare. It's by far the most popular Medicare supplement across the entire United States. It's in every county, it's in every zip code. You're gonna have folks that know it off by name that won't even ask for UnitedHealthcare. They'll just simply ask you for the AARP brand. The great thing about it is it basically sells itself. In fact, 1 out of every 3 Medicare supplement clients that you will encounter are on this AARP product. And they're on it for a few reasons. The first and foremost, it's stability. UnitedHealthcare kind of crowns itself for being the most stable, easy to work with company that's out there. They really shines through with this AARP company. The rates are already basically planted in there for you, so you don't have to worry about a ginormous rate increase like you do with some of the smaller local carriers. UHC is big enough that they are basically built into the product themselves. As far as underwriting goes, they're very lenient too. And it really goes to the fact that they have so many consumers right now that they're able to kind of vie for some of the worse off clientele or the clientele that may need a little bit more assistance, and say they could really bring that into their underwriting. And they're community rated. So no matter who you're looking at and who you're talking to, they're all going to be able to pay that same price and same premium for the product that you're selling. Above and beyond that, they've got a great 5% household discount. So if you do have a wife and a husband that are getting the coverage together, they're going to get a nice 5% on that. And a $2 a month electronic funds transfer discount as well, just simply for doing everything digital online. The commission structure is really interesting when it comes to UnitedHealthcare as well. Instead of paying you a percentage point for the yearly rate, they actually break it down into a specific dollar amount that you're going to receive years 1 through 6, and then so forth above and beyond from there. It's very similar to the same structure that you would see in a Medicare Advantage compensation package. And then finally, we've got a turning 65 female plan G for $115.12 right there in Cook County. So it's a really awesome plan that's very well suited for the folks that are turning 65. Manhattan Life Assurance Company, or what we call as MAC, one of the best, most competitive Plan G rates that you're going to find in the Chicago market. The parent is Manhattan Life, which I'm sure a lot of you have already been familiar with. You know the carrier, you know the name. They were founded in 1850, probably one of the oldest plans that we work with, but with one of the newest products. So their household discount is a 7% on here, and when you're turning 65 and you're looking for a Plan G, if you're a female, you're paying the rate of $110.58, and a male is $127.17. Really great thing about this Manhattan Life is that it is an integrity product. It's one of our proprietary products that you can get exclusively through integrity partners like Neishloss Fleming. All of these carriers do have some really great incentive programs too. So let's take a look what that is for Q2. Right now, if you're selling Manhattan Life, you're going to get $100 per underwritten case, regardless of what paper that it's on. $50 per non-underwritten cases with Manhattan Life Assurance Company, and $25 per non-underwritten case with Manhattan Life Insurance Company. So it's really great opportunity for you to earn some additional dollars on some of the most competitive products right in your market. Now switching over gears to Central States of Omaha, or I call CSO. A lot of carriers right now are focusing on Plan G, Plan N rates What CSO has done right now is really back some very competitive Plan F rates. So those are the folks that have already been on Medicare since before 2020. So they'll be switching plans, shopping for more competitive premiums, but most likely going to be going through underwriting as well, so they should be healthy. If they're healthy enough to pass underwriting, they're going to be surprised by the rate that they can get. They're backed by Berkshire Hathaway, a huge leader in the market right now. They've been in the market for 32 years. They've got an AM Best rating, and it's at A-. 7% household discount, age 70 for a Plan F. So again, these are the folks that have been on Medicare for a while. If they're looking to jump ship to CSO, a female will be paying $138.67. Male will be paying $159.50. Let's take a look at their Q2 incentive. So again, we've extended their bonuses from Q1 to Q2. So you get paid on every qualifying case that you could start today. So $225 for issued underwritten Plan F business and $125 on all other underwritten cases with CSO. It's a huge benefit. If you've got healthy clients that are looking to switch from one MedSup to another MedSup or even hop on MedSups for the first time, this is a great program that they would love to have your business. Switching gears again over to Aetna this time. Aetna's got a couple of different products in the Chicago market. First and foremost, we'll talk about the AHIC company, Aetna Health Insurance Company. It's got to have the most competitive Plan N that's in the market right now. It's Aetna branded, so it's already national. Your clients are really going to know who Aetna already is. 7% household discount with a very competitive Plan N at $65. Females coming in at $83.97. Males coming in at $96.54. And what we've seen is that their commission on these Plan Ns are the market leaders in the market too. So you're making more dollars per app on the Aetna health insurance plan than any other carrier out there. Still Aetna, but they have really brought out this new Ascendo, a CVS company Aetna affiliate. So if you have any clients out there that still don't know who Aetna is, I guarantee they're going to know who CVS is. So Aetna is now the parent group, or CVS is the parent group for Aetna, but they're really coming to the market with a 14% household discount, which is huge in Chicago. I don't think you're going to find anything higher than that. But again, top carrier, including the household discount. So if you add in that discount, you're really at the market leading for competitive pricing. When you're turning 65 with a Plan G, your household discount included. If you're a female, you're going to be paying $102.94. A male is paying $118.41. For 65-year-olds going on to a Plan G, female is $119.70, and a male is a little bit more expensive at $137.69. Aetna really stands by their products as well, and because the Aetna group is now, or the Ascendo brand, is one of the Integrity proprietary products, we do want to come out with some additional opportunities for them too, to get you some additional dollars in your pockets. So if you do submit some qualifying applications, you can receive the following bonuses. Underwritten electronic applications, you get $100. For paper apps, you get $25. For open enrollment, you get $25 for electronic applications and $10 for the paper applications. And if you're doing anything online, it really shows that this carrier is hoping that you do more of it with them. It's a very simple process. They've even got a great sandbox tool on the Aetna supplemental website. So you can go in, you can try out an application, submit an application without it going through, just to test the waters. And as soon as you're comfortable, go in and make the actual change and submit it for any of your clients. They're going to love it. But pairing that with any of the ancillary products that Aetna has in their portfolio, including dental, vision, hearing, cancer, hospital indemnity plan, recovery care plans, home cares, and protection series final expense. Aetna is really a one-stop shop for final expense, med subs, and all of your ancillary needs. And as for a quick recap, we talked about AARP, their Medicare supplements. What are the most important things? Well, 1/3 of any MedSup clients out there are on this AARP product, and they've got some very lenient underwriting. Manhattan Life has got some really great competitive products for Plan G, ages 65, so you're turning 65 looking for a Plan G, great opportunity with added incentive programs as well. CSO is for those folks that are already eligible for Medicare have been Medicare eligible since before 2020. And if they're looking to switch rates or switch their plans, Plan F, the most comprehensive plan out there, some really competitive rates for you. And then Aetna, they've got a couple of those plans, but very far and above for competitive on Plan N is the Aetna Health and Life Insurance Company. And Ascendo, that CVS brand, is a 14% household discount with additional incentive programs as well for electronic applications and paper.
So we covered a ton of great content here today on the Chicago Medicare market, and we want to do business with you to partner and grow that relationship and build that business in this geography here. So now what? Right now, the best thing to do would be start getting your contracts submitted. As we get closer to the annual election period, things do tend to get busier. We have certifications coming up around the corner, and this is the best time to make sure all of your contracts are in order. So if you haven't done a portfolio review, give us a ring. We're happy to go over it. Make sure that you have each individual piece. So when we come to the AEP and new products are coming out and new applications are coming out, you have access to all those different things, because end of June is going to be certification season. And for each of these Medicare Advantage carriers, going to have specific market certifications you need to complete. And you won't want to be disrupting that while you're trying to go through and waiting for things like that. Additionally, we usually start planning for AEP right around now. We've already gotten some business plans in, a lot of different structures in place. So you need to have those contracts in place if you want us to partner with you, if you have any co-op opportunities, and you want to get access to any type of community resources. If there's retail locations you'd like to work in, all of that really starts to go into effect in July. And if we don't start right now, it could delay that process from happening. But overall, we're looking forward to working with you. We'd love to partner with you on your business. So if you have any questions, feel free to post in the links below. We will be available for another hour, or pick up the phone and call. The number's right here. Thank you so much for your time, and we look forward to hearing from you.